Make it quick. Hey, everybody. Welcome to EMS Office Hours. I am Jim Hoffman.
And I'm Dave Brenner.
And
once again, we're playing the Where's Josh game.
Playing the Where's Josh game. I'm gonna start putting like a little picture of Josh like up in the upper corner here of my screen.
Oh, like so it looks like he's there. In San Diego.
Yeah. Just to see if if he shows up there. So listen, I want to welcome everybody for joining us live. I can't see everybody here in this stream, just so you guys know. I think most of the people that pop in are from Facebook, and they have to be logged in, I think, to Facebook in order for me to see them in the feed. So be sure that if you're watching it, hit the like button or try to comment, and that will let me know that you're here. Even if you just comment and say hi or good morning or what's up, I hate you, whatever it is, just something so that we know that you're there. And then this way, we know that you're partaking in the discussion. And, Dave, I was talking to you before we started the show, talking about EMS being out of business, right? And I came across something the other day. Hey, Tony, and it was a service that is like an urgent care on wheels, a mobile urgent care, where they will come to your home and treat you for non-emergent issues. And at first I'm like, okay, well, that's nothing really that new. There's other things and other services that have done that.
Doctors used to make home visits.
Right, yeah.
I remember that.
Yes, me too.
That's how old I am.
So yeah. So I went to the website. I thought maybe it was just like a local thing, and then I started realizing it is like this. They have offices all over the U.S. And then I went and looked at all of the all of the conditions that they treat. And we're talking about, non-emergent stuff that we get kind of irritated with in EMS, the anxiety calls, I have a bed sore, I've got the flu, or I have some nausea, nausea or vomiting, stuff like that. But they also have listed here things that they treat like, COPD exacerbation and asthma attacks and, head injuries and heart palpitations and respiratory infections, kidney stones, all types of things like this. And I'm thinking, okay, well, I wonder if this is something that is gonna, this never put us out of business, but something that we need to address as a profession, that, okay, we have something else coming in that is going to be offering on-site treatment for this, not us coming there doing our thing and then taking them to a hospital. They have to wait hours on end to be seen for something like dizziness or, a constipation or something like that. And they also, I was looking at some other things they do. They do IVs, they'll do blood draws as well. They call in prescriptions to the doctor for you. They let your doctor know what they did and why you called them, if forward any kind of findings they have and things like that. They'll do EKGs in the home, things like that. So I start thinking, okay, is this something that could be helpful to us because of the amount of the call volumes that keep going up and up, or is it something that can hurt us going forward, as a profession? Maybe it'll drop the call volume down a little bit, but maybe it's going to, make it to a point where we're not as needed as before. And maybe that's a good thing. Maybe it'll be where we get called for only emergency calls.
Maybe. Although I have a few suspicions about which way this will go. I think it's great for a consumer to have choices.
Yeah.
And I think it's,
the educated consumer, though, right? The consumer that
like Cy Sims, an educated
right,
consumer is our best customer.
Yeah, I remember that commercial.
Yeah.
Yeah. You
But
know,
yep. So yeah, you know, and using our resources correctly, Thanos would be happy about that. If we only used our resources correctly, he
right.
wouldn't have had the blip.
Wouldn't have to do it right. Exactly. Wouldn't have to snap his
Yes.
fingers.
So I'm not worried that they're going to cut this our need in half. Um, you know, it's interesting. We can whine when we take these calls that we believe aren't, and I'm you know, got the finger quotes going here, worthy of an EMS
Right.
response.
Yeah.
And then we worry sometimes when we see something like, you know, urgent cares or mobile urgent cares come up,
Hmm.
that it'll take away our jobs. And yeah, as some of the people are pointing out here, you got community paramedicine, which was
That's
going down that
that's
route
the
too.
first thing that I thought about was that, you know, that the community paramedicine, I think, you know, is something that is doing this, should be doing more of this, rather than ambulances. And then on the other side of this, Dave, is also this tendency that I've seen over the years too. You got a lot of the visiting nurses and stuff like that. They go to people's homes for similar things too, and then they get there, and what do? They call 911 because they're trying to cover their ass and they're afraid that there's something underlying that they don't see, and they want the patient to go to the ER to get further evaluated.
You know, I agree. And I looked up the link. I don't want to mention the name because it's a specific service that you had suggested that we look at. Maybe you're comfortable with that. And you know what? When they talk about what they come to treat,
Hmm.
they don't list having a heart attack. They don't list having a stroke. They list
Yeah.
people who've had a stroke.
Right.
They don't look, you know, they're not listing people who can barely breathe. You got COPD. How many people go to a pulmonologist for COPD? Well,
Yeah.
they'll come to you. I think that's pretty cool, you
Yeah.
know. Um, or you, I think that stuff is good. I do think as people are just who we are, that people will misuse it. The way, listen, I have an urgent care facility in my district, and we are there almost daily,
Hmm.
if not several times a day, to take people to the hospital who went to their doctor because they were actively having a stroke or they had chest pain. And listen, the urgent care loves it. They come in. Oh, you have chest pain? They run a 12-lead EKG, which is completely billable. They'll give you a penny's worth of aspirin, and they call
Exactly.
in 911,
Well,
where they
and the
should
funny
have
thing
gone
is,
in.
I think that, like you just mentioned, you go on a daily basis. I mean, I've done the same thing. I think most of the people probably listening are going to feel the same way. They
Sure.
probably live in areas where they are constantly going to these urgent care centers or doctor's offices on a daily basis to get patients who are, like you said, having an active stroke. I mean, I've had people who actually gone to urgent care legitimately because they were having nausea, vomiting, or they were dizzy, and then they get there and they find that they're bradycardic or they find that their blood
Right.
pressure is super low. And then for that instance, of course, yeah, then you're going to need a trip to the hospital for that. You
Sure.
know, um, but the one thing that I saw with this when I was looking at the website was the response time of their mobile units. They say up to 2 hours, but when you call up and you say what your situation is and whatever, then they
Yeah.
tell you a more accurate, time frame. But they say average is 2 hours.
But that's
How many
cool.
people are going to be waiting that time if they've been up all night, with a migraine, or they've been up all night throwing up and whatever, or coming out of
It's
both ends?
it's not meant for
They're
them.
tired. They're tired of waiting, right? They're not going to wait another 2 hours,
And they don't want to go to a doctor's office where everybody
right?
nowadays the doctor's office is just a breeding ground for people
Hmm.
who have respiratory ailments and
Yeah.
other ailments.
Hmm.
And and some people have less mobility and are going to welcome this as more a different kind of service than they're used to getting, better. When I say better, or let me say different than getting the visiting nurse who comes to the house who
Yeah.
says, yeah, so now I need to get you to see somebody else. You know, NPs and PAs, they are the bomb on a lot of this stuff. Even doctors coming to the house doesn't mean you're not going to be told you need to go to the hospital.
Right. Like just like with us, right? We're limited on the diagnostic tools that we have and our knowledge base even on what we're going to tell somebody is going on with them one way or the other. And the same thing with this, right? They're limited with what they're going to have and be able to bring to somebody's home to evaluate them and test them and things like that. So they're going to at some point do the same thing and recommend, okay, you should go to the emergency room, or you should go to your doctor, or you should go to a specialist, or whatever the case may be.
But there's more, because on this site, which I think the site is set up, maybe not for me, but for most people, it says, how do I pay for this?
Yeah.
And they talk about, the average person pays $5 to $50 if they have insurance.
Yeah.
The greater their deductible, the more their copay, the more they're going to have to pay.
Mm-hmm.
And then somebody, then they have an FAQ that says, well, what if I don't have any insurance at all? And they indicate, and this is almost unfathomable for me. They say out of pocket is $275. So I'm thinking, $275 in Manhattan is like, hey, I'll do that. $275 out of pocket. I don't have insurance, but it would be different. I'm thinking in Butte, Montana, or Fargo, North Dakota. The out of pocket, where costs of living are different. I'm not putting down these places, but it's really hard to compete with the cost of living in Manhattan.
Yeah.
People are leaving Manhattan for that reason. So, but I wonder if that $275, when you're paying out of top, and just think about it. If you don't have insurance and you call an ambulance, how much are you going to get billed just for the ambulance?
Yeah.
So, people want to hedge their bets. This might be a way. And as long as, go back to that educated consumer, there should be a list. You go to a health class in 10th grade, and we should have a list. The following are not complaints you bring to your local doctor, urgent care, or the visiting nurse, or any of the visiting services. You have chest pain. You have chest pain rating to your jaw. You passed out. You can barely breathe.
Right. That's the thing. It's
Tony and Mike are really lighting up the board. They got some good comments going on there too.
Yeah. No, the thing is like you said, that there's the education end of it. But I think at the same time, though, is it's hard to
Mike just told the joke.
Educate the people, and then also, get them to understand the full concept of what they're calling for. And that goes to what Mike is talking about this impression that they go to they go by ambulance and they get seen.
We'll take you directly to the back of the line.
Right.
If that's where you would have been when you walked in, that's where you're going to now.
Right. Exactly.
Yeah. You would think, maybe somebody in the hospital is going to get wise to this. Maybe they're figuring it out. If we keep coming in by ambulance, because I've got an ingrown toenail, which, I get it. It could be really bad. You can get septic from that. But yeah, you're going to the end of the line. If you're not, they'll take your temperature, they'll take your vitals and put you in that waiting room with everybody else who's sick.
Right. Well,
they'll tell you to wait outside in your car.
One thing I will say that I thought was a little humorous was when they talk about who they're sending to the home, and
who are the dispatchers providers?
Right. Who we send, and they send two people, and it's I'm trying to think. What did it say?
They said a
nurse,
PA or a nurse practitioner and a dispatch healthcare medical technician.
Yeah, that means EMT or paramedic.
Well, they actually said medical technician. I mean, it could be a medical technician.
Yeah. I don't know. I was looking at some of the which, by the way, if you want to work for something like this and you're a nurse or a physician assistant or an EMT or paramedic,
they got a career page.
You can private message me and I will send you the link to the company, and you can, find a job there if you want. I don't know what they pay or how it works, but if something you're interested in, you just private message me. I'll go ahead and send you that. over on the Facebooks or on the YouTube, whatever. Be more than happy to do that for you. You know, Mike is talking about. You see what Mike has said about. What do you do if how about charging people extra money if it's not an appropriate use of EMS? And I think nowadays, right? Don't insurance companies, especially the private ones, go, well, you call an ambulance, you didn't need an ambulance, we're not paying for that. We're not paying for the ambulance. We'll pay for the ER visit, but you didn't need an ambulance. You could have taken a cab or you could have driven yourself, to the hospital.
It's interesting because then the ambulance companies may get stuck with a non-paying customer.
Yeah.
That might not necessarily be right.
Yeah.
And maybe better screening, maybe enabling, ambulance companies to make up. You don't fit the definition of who should be getting this service. You call.
Yeah, I mean, listen. Listen. I've seen attempts, at agencies and localities trying to lessen the ambulance dispatch. Even to the point where if depending on what you say, they don't send the ambulance right away. They let the fire department get there first. There's one place I saw for car accidents, they weren't dispatching ambulances directly to the car accident, because how many car accidents do you get dispatched to and you get there, it's nothing, it's a fender bender, everybody's out walking around, nobody has any kind of medical complaints. So they let the first responding, the fire truck get there first, or the police get there first, and then if people are complaining of injuries, they dispatch the ambulance. So there's a delay, that 5 minute or so delay of an ambulance getting on a road, to a wreck, but they feel it's lessening the response times with that. So I think that there are attempts by agencies trying to do it, by dispatch trying to, like you said, better triage calls when they're taking them to dispatch ambulances more appropriately. There are ones where there's dispatch systems where they feel it's not worthy of an ambulance, and then they transfer you to a nurse that they have on call, and the nurse calls you.
So they answer the phone. They go, "Is this a police emergency, fire emergency, medical emergency, or do you need an Uber?"
Right. Yeah. Yeah. I know. Listen, I think Uber trying to do that too, right? They're trying to do things where they'll take you to the emergency room.
Why not?
Right. They have special Uber drivers that just do that, that are just looking to get you to the emergency room, because of the fact that the ambulances calls, the ambulances are expensive, and and people know that, hey, I don't really need everything they can do for me in the ambulance, but I really kind of got to get to the emergency room. I don't have a way to get there. And rather than get that big, huge ambulance bill I got last time when I went because I had a bellyache, now I'm going to take an Uber. It'll be a lot cheaper, and I'll still be at the emergency room. But then it goes back to what Mike was talking about. And, well, I'm not going to be seen any faster by Uber.
You're not going to be seen any faster by the ambulance. We need to get.
But in their mind, I'm saying, they think, okay, well, Uber, there's no way I'm going to get seen faster. But maybe with the ambulance, I got a certain percentage of a shot of getting a bed as soon as I get there, and stuff like that. You know what I mean? So listen, I don't know. I don't know if I think this is. I don't want to say it's going to help or hurt EMS. Overall, I think it's, like you said, it's giving people options. It might lessen call volume and ED visits, for areas, and again, that comes down to educating patients and educating the public on what these types of services do, rather than just, I think there's got to be a lot of advertising and social media, stuff like that something like this has to do to get people to understand that this is an option other than calling 911. But they can't say that because, they told me not to call 911, to call them. And then you have a whole nother, issue going on, So I don't know. I'm going to end it with that part of the conversation there, Dave.
Mm-hmm.
I don't know if you
Mike
have
and
any
Tony, thanks.
comments on it.
Who else is there? There's Joe. Thanks for signing in, saying hi.
Yeah, I appreciate guys making comments and hitting that like button. I really appreciate it. It does help with the flow of the show. It helps keep it in the feed on the social media platforms like Facebook and YouTube and stuff like that. So appreciate that very much for partaking in the conversation. If you ever want to come on live with us, you just send me a message. I will send you a link, and you can join us live on a show when we come on a show at another time. So, Dave, one other thing I want to talk about. I know you are traveling today, so I want to keep it too long. But I saw this meme, and I started thinking, I wonder if people are getting this sort of attitude, or if people listening are maybe seeing this attitude of, you hear about EMS being understaffed, not a lot of people working, call on volume is really high. And now people getting this mentality of, I don't care so much about a lot of the minutia things that I'm responsible for in my job, because what are they going to do? Fire me? There was a meme that says, my lieutenant's yelling at me because I'm 3 charts backed up, but I don't care because I'm the only one here to work the next 24 hours. And I'm wondering if people are, the fact that there's like a meme and then a bunch of likes and a bunch of little comments on it. I mean, it's made for humor, of course, but I wonder how much truth there is to that. Considering the environment that we're in right now.
It's beyond EMS.
Well, yeah.
It's everywhere.
What's that?
It's everywhere. What are they going to do? Fire me? There's nobody to replace me.
Yeah. So, and so I'm wondering, if other people are seeing that, like their coworkers, kind of being a little more relaxed, kind of more laid back. I'm not going to be in a big hurry for this call, for that call, or my paperwork. Because I feel like I have the best job security I've ever had, because there's nobody lining up to take my job as in the past. I mean, I remember in the past, New York City, working 911 for, voluntary hospital, that was a prized job.
It was.
You couldn't get that job without experience, without, being on 911, being an EMT or a paramedic for a while. You couldn't get that job. Now, it's not that big of a deal as it used to be, because they need bodies.
Yeah.
What's that?
They're desperate.
Yeah. And that's not just New York. It's everywhere. That's like that. And you go back and forth. Oh, they're not paying enough. Oh, it's not a shortage of EMTs. It's a shortage of people that want to pay for the EMTs, or the work environment, and go back and forth to all of that. I know that my friend Greg Freeze from EMS One just posted a thing about, is it finally time to pay, EMS workers more money? And that sparked a whole thread of, education and more money, and, nurses do this, and, just.
Wait, conversation number 4. We don't have to have it again.
Yeah, exactly.
It's conversation number 4.
Right.
Until somebody does something about it.
Right, exactly. So what do you think, Dave? Have you seen any of that?
I've seen that. I'm going to tell you where it's particularly hard. It's particularly hard in the volunteers, but that's another topic. But you can see it everywhere. You can see it if you go to McDonald's. You can see it. My doctor says, you go to the doctor's office. He says, listen, we're having problems. People would rather be on unemployment than work. And if they don't want to show up, I can't fire them, because if I fire them, I'll never get them back. And I need people to work.
Yeah.
And I see it at the dentist. You see it everywhere you go.
Yeah, it's true though. I mean, listen, I was just actually talking to my landscaper.
Although there's no shortage, I think, of people applying to Fidney or Suffolk County PD.
Yeah. I talked to my landscaper yesterday, and he was talking about, he has an issue. He's going to have plenty of work, but I can't get people to come work that are reliable. So he's like, I don't want to take on jobs that I can't do for people
That'll
because I don't
just
have
lower
enough
his
workers to do it.
reputation.
Yeah, you know.
I get it.
So and that's like think about that. That's like you said, it's all over. You know, so I wonder if that is. And my opinion is, and
What we need in this country is more unemployment,
yeah,
because
my
that'll switch things around.
my advice is Josh isn't here, so we can't talk like that, Dave.
That was sarcasm.
I know, but still, Josh is not here. So. It's I will say that I encourage people that not to have that attitude because it is a reflection on you, not so much on your agency or anything like that. You know, you still have to do your job, you still have to do the charts, you still got to restock your truck. All that stuff is still there, and if you're not doing it, you're leaving it on to the next crew that's coming after you. You know, and it really is. It ends up being a reflection on you. So don't have that attitude. I know it gets rough when you're running calls all day. You have a chance to wipe your ass. I get it, you know, but try not to get that burnt out sort of attitude because that can be contagious.
Sometimes the burnout occurs like immediately when they're 22 years old.
Oh yeah,
I've seen
within a week.
Yeah, and part of it is instilled. You know, what are you instilled with during school, from your house? What do you bring to the job that's you?
Mm-hmm.
I can't leave charts. I just can't do it.
I can't
leave
either.
Charts. First of all, I can't remember. If I have two patients in between my writing a chart, I don't even remember that patient. But
no, I've never been. I've always been that way. I mean, I've had partners that would have charts like piling up. I'm like, dude, what are you doing? I'm gonna get a cup of coffee. Get a cup of coffee. You're like 3 charts behind. There's no time for coffee, you know. And I'm like, for me, I'm like, you know what? I have to have the charts got to be done before I can relax, before I can eat, drink coffee, go to the bathroom, anything. I have to get that done. It's like this thing over my head that I've got to complete.
Wow, look at all the rabbit holes we can go down from the comments here.
I know.
You know, so yeah, we could go into corporate culture.
Well, you do find that, right?
Responsibility, worried about lawsuits.
Yeah, and this person here on YouTube, I don't know how to say his name. I don't know if it's a real name or maybe it's just a username.
It looks
but
like
he's talking about, you know, the culture. And I've seen different agencies where the culture is different, you know?
Yep. And a lot of that's from the top level of expectation and support. And listen, that's why they have degrees in organizational psychology and management and leadership. And yes, there's just an article in the EMS world where they go back to a quote from somebody who said EMS management is going to go away. What we're going to need is EMS leadership.
Well,
sounds
that's the
good
thing too, and I think a big part of that EMS leadership end of it is people being taught how to be leaders. You know, for many years. I'm gonna go to this is another whole freaking discussion, but
yep, another rabbit hole.
Yeah, you know, many years with the people.
Maybe we should bring this back.
Well, the people that became supervisors were there because they've been there the longest, right? Or they know somebody, and
a position of endurance.
Yeah, I know that's true. But you know, and I think what's happening now, and I've seen it happen, where agencies want you not necessarily to have a degree in EMS, but they want to see that you've had some sort of training and education in leadership.
Yeah,
you know what I mean. So you know. All right, so Dave, we'll end it there, man. Willie, thanks for popping in real quick, leaving some quick comments for us. Please, guys, be sure to hit that like button, whether you're watching this live or if you're watching a recording. Do me a solid and hit the like button. All right, it's a small fee.
It's more than I get paid.
Right, it's more than I'm getting paid. So please, just do me a favor and do that. It really does. Keep this in the live feeds on Facebook and on YouTube and stuff like that. And it does help people that don't know about the show that might come in later on in the day today at 12, 1 o'clock in the afternoon. They might see it pop up. And
when they're waking up.
When they're waking up, yeah.
You got
Like
somebody
Josh.
specific, yes.
When Josh is waking up, because of course, once again, he's not here, but I'm sure I'm gonna get a message later saying, I was there, where were you? Or, I forgot. But we'll see. Maybe next time, Dave, we'll get him.
Maybe.
Yeah. All right, so they will end it there, man. Any closing thing, any closing comments you want to make or anything?
I think not. I think your final 2 words are the ones that would be my final 2 words, and I'll leave them to you. All
right, guys, everybody. Thanks again for joining. Share this page, like the page, send me a DM if you want to hear us talk about a certain topic maybe we haven't talked about. If you want information on the company I was talking about the mobile urgent care that hire EMTs and stuff and nurses, direct message me on Facebook or on Instagram, whatever, and I will go ahead and send you that domain so you can do it. Check it out even if you're just interested in seeing what I'm talking about. You can go check it out. So that's it. All right, everyone. As always, I am Jim Hoffman,
and I'm Dave Brenner.
Stay safe.